Good afternoon. I'm Dr. Stephen Harrison. I've been asked as my capacity for the City Health Officer to give some updates on the COVID and related measures. I've been doing this for 35 years, and so we have a little gray hair experience we're going to share with you, but also hopefully you'll see some cutting edge about the COVID that we're going to relate. And so I've talked with Aaron, who has been so gracious to join us here today, and thank you for that, to go over a series of things. I've laid out some articles. Those of you who do still read the newspaper may have seen some of this stuff, so this may be a little duplicative, but by the same token, hopefully some is new and impactful for you. So the issue is, first of all, is COVID the real thing? It is the real thing. I think most of us know that. The deaths are real, but the real issue is what can we do to manage our risks? So life is about risk management, and we'll talk about that in some more detail over time. But one of the things I like to set straight in terms of risk factors up front is please don't take your news as the guide for how you view COVID. Okay, because the problem with that is that very misleading. You would think, for example, if you have a certain demographic, if you are a certain age, if you're a certain color, if you have a certain disease condition, that it's curtains if you get COVID, okay? But the bottom line is that most people in all demographics survive. COVID does not pick on seniors because of age, does not pick on black people because of color of skin, doesn't pick on diabetics because they have a disease state. This is all about picking on a weakened immune system. And the number one reservoir of our immune system is the gut, and so we want to keep that in mind. This is coming from confessedly the world's former oldest teenager. By that I mean I ate too much junk food, but that part of my life has passed me over, and so now we want to put the good stuff in, and so do you, because it makes a difference. So what we don't put in, as in junk food, processed food, sugars, and what does matter for our immune system, whatever our weight is, put in the good stuff, put in the greens. One other thing as I look, I'm pretending to look the camera in the face, look Aaron in the face, however this works, is to say that, hey, one thing, whatever else you do put in your body, put in vitamin D. Keep in mind that there's been some great studies about this pandemic and correlation with vitamin D blood levels. In other words, the better and higher the vitamin D blood level is, the less severe the outcome from COVID should you happen to get it with or without getting the actual disease exposure, etc. Also keep in mind this, that north of Atlanta, Georgia, and I did check the geography for that. We are north of Atlanta, Georgia. You cannot get enough vitamin D from November to April. So the number one take home is, yes, high dose vitamin D, okay? So a lot of people say, well, I take a multivitamin, it's got vitamin D in it. Most of your multivitamins have about 400 units in it, and maybe 800 on exception. You say, well, I'm taking a few calcium pills. Still not the numbers we're talking about. I'm talking about a minimum of 2,000, preferably 5, even 10,000 a day, okay? And at first, those were recommendations from various groups, sometimes complementary medicine, to be clear, but highly rated infectious disease specialists, endocrinologists, supporting these type of numbers and concepts. And now the studies are out in the past 2 months that show absolute verification and validation of that concept, okay? So take-home message is we are making some impact on this process. This is a multi-system approach that affects many organs throughout the body, not just the lungs, and we've been recognizing that for some time, but our approach of treatment has broadened, okay? So while there is no specific treatment yet, despite what the president's had recently, no specific treatment for the COVID, there are things that seem to be making a difference. So you often see some antibiotic because, like Zithromax, it helps the immune system, it helps treat collateral illness. You'll see the high-dose vitamin D. You'll see inhalers used because it is often mainly a respiratory condition. I'm not going to go into all the other things about the taste distortions and some of the other things like COVID feet that come along with this condition. One of the things you haven't heard a lot about, I didn't pull out that article, but COVID encephalopathy. And so think of encephalopathy, one of those big words we know. We hear about encephalitis, so as an infection with encephalitis, apathy, the disease process, pathology involved. So something wrong with the mind, inflammation of the brain. And so this can happen at any age, but it's going to impact our older folks a little bit more, or those who have an underlying condition with some memory problems to begin with. They're going to be more prone to that, and the more medicines that you get might be more prone. But it can happen on its own to anybody. So encephalopathy, that big word, in which things just don't quite seem to come out right, and they can be across the board in terms of how much it varies. The double pandemic about the issue of the COVID is the other pandemic is not what you're hearing about in the news about the flu coexisting. Again, once again, realistic reminders for people to get their flu shot, but again, once again, the fear-mongering that the news tends to do. The real double pandemic, though, is not the flu and the COVID occurring together. The real double pandemic is the COVID and obesity, okay? What you don't hear in the news, flat out, far away, bar none, obesity is the biggest single risk factor for the COVID. And you're not hearing much about it in the news, but it's absolutely, all the infectious disease people will talk about that. One of the things, so we've got some stuff about the Black Plague in the Middle Ages, the polio comparisons and the like, proper breathing techniques, herd immunity. I'm going to leave some of these things with Aaron, who's going to figure out that after he reads these, they may or may not be worth putting in, but he'll probably say, I can do a selfie and talk better than Dr. Harrison can, and that's probably true, but this is the thing, I guess I'm still city officer, but it might be open for debate and speculation later. Herd immunity is a nice concept, but the reality is, when do we get there? When do we have enough people who've had the condition or the vaccine to have enough immunity? I'm going to come back. I'm going to incorporate that in the risk calculations a little bit, etc. And face masks, we've been asked to say a little bit about face masks. So the process about face masks is now we're gathering more information, and we see in widespread areas that where face mask is universally either accomplished or mandated and to a high degree implemented, we see better outcomes. And so what maybe was once upon a theory is the reality. There's very few indications not to be wearing them. In other countries have been wearing them for years, and the little kids, the younger you start, they do get used to these. So I would encourage that to be done locally. Does it screen all disease? No, it does not filter out all disease. Nobody's ever pretended that. But if nothing more, it's a reminder of all the other hygienic things you do along with social distancing. As well as what I call, for lack of better medical terminology, the goober effect, okay? We lessen particle size when we coughed into that mask as opposed to spewing the organisms across the room. Now speaking across the room, just about the time when we're used to doing the 6 feet plus like Aaron and I are right now, what happens, the news comes out with some hype. This stuff can go 15 feet or wider, maybe even 25. There's reports as though these organisms are superorganisms. Listen, what we have to realize is life, in a nutshell, is where you take your risks, okay? So the biggest risk probably that Aaron and I will do today is to get in our cars, okay? So we have to use that as a frame of reference when we're talking about where do we draw our risk, because some people think we've done this. And so, the problem is, where do our civil liberties confront social propriety? And that really is a challenge that nobody has the perfect answer for. So in the interest of public health, we tend to steer towards more the social proprieties and say, hey, for the sake of some individuals, if not the majority, These are things to consider that we do for the collective good. By the same token is people legitimately say, well, what's really different about this than influenza outbreaks in the past? To some degree, it's a matter of scale. Conceptually, there's really not anything differently than flu pandemics of major proportions. In fact, within the year of my birth, my first year of life was a major pandemic that killed more people proportionally to the population at that time than we still are at this moment. And so we need to scale everything. But by the same token, when we say, well, okay, if during this pandemic we had less automobile accidents because people weren't going to work, they weren't traveling, they weren't taking trips, etc., as much, is that a justification for us to keep the roads closed? Okay, what really about restaurants? What really about churches and schools and the like? And once again, it's where we draw a risk. How do we size them up? How do we come to act as a community recognizing that, hey, if people don't have jobs, okay, then they don't have insurance, and whether or not they get COVID, they may suffer other consequences in their life, health consequences for one, but major economic problems that take a significant toll on their family, themselves, and the like, that may be very difficult to recover. And this is part of the problem. You know, Aaron, if we talk at the start of this, the leading infectious disease people say somewhere between 70 to 90% of this are going to get this condition. They said that up front before this is all over. Then do we fear getting it? Do we protect ourselves, you know, before the vaccination, before effective treatments come out, etc.? Okay. Who do you trust when early on the government says, hey, shut everything down for 2 weeks, flatten the curve and life is good? And then that doesn't really materialize even when most people went along with flatten the curve. So if people are becoming disenchanted with the things that have been proposed and purported by health officials, government, etc., understandable. Because I think all of us have some of that legitimate frustration. But the point, though, is to still put it out there and keep getting more facts as opposed to hype. You know, the bottom line is stuff is simple, okay? You know, the face mask is a simple thing to do. Once you get used to it, it's not all that bad. The hand washing, I mean, it's everywhere now and should be and will be going forward. And there are things that we're benefiting from a society, from a medical profession in terms of going forward. And that includes very simple things. Simple things will get the job done in many of these cases, okay? Saw, you know, a 99-year-old gal who you would never know had the COVID here recently. And in fact, I'm asking the nurses, wasn't this one of our COVID patients here, right? Yeah, 99. So, yeah, we're seeing more and more people survive this of all kinds of the demographics that we talked about. But risk-taking, and what degree do we go to, and for how long do we go to impose upon people civil liberties? We need to get on with society. All the things that we talked about, church, school, eating out, your business, anybody's business. We need to find a way to make this work. And I struggle because I don't have those ready-made answers, okay? But, you know, as a libertarian, I'm for, you know, at least defining the risk so that we can define, well, here's your own individual risk. Here's things that we cannot do because it's a social concern of a larger nature. And we've got already on record things that everybody goes along with that already in terms of other vaccinations and the like for schools, et cetera. And the process. Now, I had said earlier in the preliminaries, Aaron, that feel free to ask questions and whatnot, but there's probably some obvious things that I've left out, so I'll turn to you and say, you know, if you've got any questions about things, please let us know.